Okay, greetings everyone, and many thanks for joining us today. My name is Julie Eit, and I'm a Senior Director at the Clean Cooking Alliance, and I'm very pleased to be kicking off the webinar today. This is now the 5th in our Transitioning to Clean Cooking series, which was developed by the Clean Cooking Alliance and the World Health Organization as part of the Health and Energy Platform of Action. And our goal for this series is to disseminate the latest data and tools that can help to stimulate increased action on clean cooking and better inform planning efforts. So today we will be launching a new state-of-the-art global tool and the only resource of its kind that's currently available that's been developed by the WHO called the Benefits of Action to Reduce Household Air Pollution, or Bar Hap, which allows users to conduct cost-benefit analyses of various transitions to clean cooking. So this is a really exciting and definitely needed resource for this sector. I think really for me, from day one of working on this issue, have heard this question of, how much does lack of access to clean cooking cost an economy in terms of the negative impact, and what would the benefits look like in monetary terms if we're able to solve it? So really important tool, and exciting that our colleagues at WHO and their partners at Duke University will be launching today. So we have a packed agenda as always. We can go to that slide. We'll hear opening remarks from the WHO, and then hear a little bit more about the sort of why behind the tool, the connections between household air pollution and health. Then the WHO and Duke University teams will walk us through how to use the tool and give us a live demonstration. And then we'll have some time for Q&A specifically on the tool. And then from there, the Duke team will talk us through some examples of how the framework that was used to develop the tool has been used in practice with 2 specific case studies of cost-benefit analyses that were conducted for Nepal and Kenya. And then we'll have another Q&A and discussion for the last 20 to 30 minutes or so. So just a few housekeeping items before we begin. Please use the Q&A function for any questions for the speakers. We'll try to get to as many as possible when we get to the Q&A session, but no need to hold your questions until then. We'll be collecting them as they're submitted throughout the session. So feel free to submit those anytime. We will record the session and make slides available on the web page for the webinar series afterward, which is also where you can find some information about upcoming webinars. All right, so with that, let's go ahead and kick things off. I will now pass things over to our opening speaker, which is actually will be a bit of a substitution here. We'll be having Heather Adair Rohani from the WHO providing our opening remarks. So with that, I will pass things over to Heather. Heather, the floor is yours.
Thank you. Thank you, Julie. I'm not able to open my video at this moment, so I'll just go ahead and give you. So thank you so much for having me here today. And this is a very, very unique opportunity to really launch something critically important. Policymakers on all different sectors are always asking, how much does it cost? What is it going to cost me? And this is a tool that really provides the numbers that we really need to drive the policy to make things happen and really accelerate clean cooking and energy access itself. And this not only provides health benefits, but environmental benefits, socioeconomic benefits. So really having this tool available for policymakers to push and provide the quantitative numbers to make decisions and make sure that health savings can be achieved and benefits achieved through accelerating access to clean cooking is a really monumental step forward, and will really be a critical tool and resource for people working in all different sectors, from health, environment, energy, social and well-being, you name it, it goes on. So now we could go ahead and move to the presentation. I'm going to give you guys a short background on household air pollution's impacts on health, and why is it WHO is doing something about this, and what is it that we're doing. Next slide, please. We'll be hearing from Dr. Jessica Lewis. She's the driver behind this tool, the Bar Hap Tool, and she's also leading the development of the Clean Household Energy Solutions Toolkit, for which this tool belongs to. So she'll be able to provide us a bit of background about the tool, as well as walk us through some examples. Next slide, please. So Clean Household Energy and the Bar Hap Tool. We'll dive into the disease burden associated with household air pollution, as well as what is this tool and how does it fit into a whole other slew of tools that we have developed or ongoing development at WHO. Next slide, please. Next slide, please. So household air pollution. We're not talking about just any old air pollution. We're talking about the mixture of pollutants that are released during the incomplete combustion of carbon-based fuels in and around the home. We really want to point out the in and around the home, because much of the household air pollution that people are breathing inside is often leaked outside, and then sometimes even recirculates back inside if open windows, or, for example, a neighbor is using polluting fuels technology. So we've transitioned to this world household to really account for all the areas of exposure to this type of air pollution can occur. And it's really derived from the inefficient use of technologies for activities, including cooking, heating, and lighting. When we say inefficient, it means that the fuel is not burned very well, and therefore large amounts of emissions that are often, which include many health damaging emissions, are emitted from the stove and fuel technology being used. And we really are focused on particular matter that is less than 2.5 aerodynamic micrometers in size. And the reason for this is because this small particles, you breathe them in, and then they don't just stop there. They transverse into the lung because they're so tiny, and then can really affect the body systemically, leading to a number of different diseases, such as ischemic heart disease and stroke and others. Now, it's not just particulate matter that comes out in household air pollution. There are other pollutants that are damaging to health and climate and the environment more broadly, including polyaromatic hydrocarbons, carbon monoxide, nitrogen oxides, non-methane volatile organic carbons, etc. Next slide, please. Now, is this a common problem? Yes. Basically 3 billion, or the most recent figure is 2.6 billion people still cook with mainly use cooking with polluting energy sources. Now, if we counted for other stacking or other uses of fuels and technology in the home, this number would for surely exceed 3 billion people, would probably be more closer on the rounds of 4 billion if you account for all the household energy and uses. Now, this number has remained unchanged for 20 years. We are now in 2021, and we still have many people are still having to rely on simple open fires and firewood to cook their meals and heat water and prepare warm drinks during the day. Next slide, please. So as you can see, this is a measure, this is an important risk to health. And this is why WHO is really involved in this. We estimate that around 3.8 million premature deaths can be attributed to the main use of polluting fuels and mainly using polluting fuels and technology in the home. And these deaths are from diseases such as stroke, ischemic heart disease, chronic obstructive pulmonary disease, lung cancer, and pneumonia. And this is typically diseases that are happening in populations that lack other risk factors, such as smoking and what have you. These are typically one of the largest sources of non-communicable disease risk in women living in low and middle income countries. Next slide, please. So in addition to the direct health impacts from breathing in and out this polluted air in their home each and every day, other impacts can be associated with the inefficient use of household energy use that impact the environment and health. For example, outdoor air pollution. One of the major sources of outdoor air pollution is actually household air pollution leaking outdoors, as mentioned before. In some countries, up to 50% of outdoor air pollution is actually due to the household air pollution leaking outdoors via chimneys or windows, and creating ill health not only for those users of the household fuels and technology, but those in the surrounding community. It's also a very important risk for climate. Almost over 50% of the most recent studies said over 50% of global anthropogenic carbon emissions can be attributed to residential fuel use, inefficient residential fuel use. Highlighting the important opportunities that such action on household energy can really have immediate impacts on improving the climate around us, as it will really eliminate some of the most and strongest short-term climate warming agents. Household air pollution and the lack of inefficient energy in use in the home is also a major cause of deforestation. The reliance on biomass fuel alone leads to deforestation and decreased biodiversity, challenging many populations who are already dealing with many environmental issues due to overuse of land and what have you, and climate change. They're faced with even more challenges due to deforestation, and they're not even able to find the fuels that they need. Next slide, please. So recognizing the important risks, but as well as potential benefits for health and the environment and our world more broadly, WHO decided and felt that they needed to develop guidelines for defining clean household energy. Now, these guidelines were something because many of policymakers in countries in the health and energy sectors knew this was a problem, but had no idea what to do it and didn't know how clean was clean enough to protect health. Next slide, please. So the WHO developed these guidelines, and these guidelines were meant to be very practical in terms of their types of recommendations and be very technical. They provide emission rate targets for fuels and technology combinations used in the home for both fine particulate matter and carbon monoxide. And these emission rate targets basically define whether a stove and fuel combination can be considered clean for health. It also provides a recommendation on how countries should really prioritize fuels and technologies in the transition to clean, recognizing that it's not as easy as flipping a switch to turn the lights on. It's going to take an integrated policy, maybe tackling certain populations with the greatest infrastructure first, and with those super clean technologies, and those for those areas where there's more remote settings and there's less infrastructure, perhaps transitional solutions are maybe the best option to improve health in the short term. And then we also provide specific recommendations discouraging the use of kerosene and specifically recommending against the use of unprocessed coal in the home or raw coal. It also recognizes the importance of the synergies between climate and health and energy. And so there's very important opportunities, for example, via climate financing for actually financing and fueling the transitional policies and programs for clean household energy. Next slide, please. So based on these definitions, we as the SDG 7 custodial agency have actually defined in this dichotomous way using survey data to help define what clean and polluting is to help us monitor progress and moving forward. Currently, the definitions based on the most scalable solutions for fuels and technology include for clean, next slide please, or click, biogas, liquefied petroleum gas, electricity, biofuels such as alcohol fuels, as well as solar cooking. The polluting fuels and technology are currently categorized as those stoves that use firewood, kerosene, candles, unprocessed coal, crop waste, dung, and charcoal. Our next slide. So, but it was important to notice in the previous slide that biomass in some cases, depending if they're paired with a technology that's super efficient, very low emission, can be considered clean or almost reach the scale of the WHO guidelines. So they're somewhat of a transitional. This is particularly the case, for example, processed biomass fuels, where the biomass actually burns much more efficiently. Next slide, please. So to take this into consideration, to provide the capacity for countries to actually implement these guidelines, WHO has developed a Clean Household Energy Solutions Toolkit. This toolkit and the tools included in this toolkit are based on regional consultations across different areas of WHO that are most afflicted with this particular risk factor for ill health, and consists of a various number of components and tools that were identified by various stakeholders that they felt would be very helpful and practical for their use in developing policies and monitoring and implementing those policies and programs to accelerate clean household energy for health. The modules include stakeholder mapping, tools to support the needs assessment and situational analysis. They also include for example, tools and particular databases to help you identify technological and policy interventions. Many of these tools are web-based and interactive, allowing countries to put in relative inputs for their own particular country context and to see what impacts that particular options would have. We also provide, for example, guidance on how one can implement the ISO standards, for example, voluntary targets for developing national standards for clean cooking to help really provide a policy mechanism and the tools to develop that at country level. We also provide tools for monitoring and evaluation, such as harmonized survey questions that can be used to provide baseline and monitor the impact of a particular intervention moving forward. We've also been developing a set of particular capacity training materials for the health sector, because we need the health sector to not only contribute to the policymaking and decision, but also need to be serving as a champion for change to their patients and in the clinic themselves, and within public health dialogues and other intersectoral dialogues. Finally, we also, to really change the behavior and to really get the community on board to clean cooking, we need to make sure that the users themselves are happy and understand. So we are also building up a set of tools within this toolkit to support communications and awareness raising amongst the general population and amongst also policymakers more broadly. Next slide, please. So currently a manual is being developed for that. It's a step-by-step guide and will be released shortly. And all of this is available online. I'm now going to pass over the presentation to Dr. Jessica Lewis to provide some information on the Bar Hap tool, one of the tools included in the chest, and specifically one to help select and choose policy and technological interventions. Over to you, Jess.
Thanks, Heather. Next slide, please. So I'll give a very quick overview of this new tool that we're launching today, and then we'll be hearing a lot more about it in detail. So in short, Bar Hap calculates costs and benefits, including for health, social impacts, climate, and environmental impacts of 16 different transitions to clean or cleaner household energy. This tool was developed with our colleagues at Duke University, and it is an official WHO tool. We also simultaneously developed a household air pollution module in WHO's One Health tool, which uses the same framework as the Bar Hap tool. And the One Health tool is designed for health system costs, but this way they're linked in their approach. We first piloted a version of the Bar Hap tool using default data for Nepal in 2019. And now what we are releasing today is the global version of the tool, which contains default data for all low and middle income countries, as well as many other updates that we'll be hearing more about now. Next, please. So please reach out with any questions, and back to you, Julie.
Great, thank you, Jess and Heather, for that really nice overview. So now, if we can go to the next slide, we'll pass things over to our colleagues at Duke University, who, as Jess mentioned, were part of the team that developed this tool. So our speakers from Duke will be Mark Juland, who is an associate professor and co-founder of the Sustainable Energy Transitions Initiative. Next slide. We'll also hear from Ipsita Das, who's a research scientist, again, also at Duke University. So they'll now walk us through a little bit more detail on the Bar Hap tool. And then, as we mentioned earlier, we'll have a demonstration of how it can be used. So Mark and Ipsita, over to you.
Thank you, Julie. And I wish I could show my video, but I guess we have some video issues.
Yeah, we're having some technical difficulties. Sorry about that.
Unfortunately. In any case, I'm going to present this next segment, an introduction to the Bar Hap tool, and we'll have a little bit of a demonstration of the tool as well, which Jessica Lewis, who you just heard from, will do. And of course, as I go along, feel free to drop questions in the Q&A, and we'll try to get to them as we can. In any case, my name is Mark Juland. I'm really happy to be here. I'm a professor at Duke. I worked closely with Ipsita on this tool, as well as some research assistants and the WHO team that helped envision and develop the tool together. So there are many people who deserve quite a bit of credit for the work that's been done. Thanks to all in the audience also for participating, and especially to the Clean Cooking Alliance and the WHO for organizing this webinar and the series of which it's a part. Next slide. I'll be introducing the tool, and I'll then after the demonstration, come back with some additional pointers about things to keep in mind as you use Bar Hap. Next slide. So first, I'd like to emphasize that this tool rests on a foundation of work that is roughly a decade in the making, beginning with a cost-benefit framework that I and Subrendu Patnaik, a colleague at Duke, first developed, which allowed considering household stove and fuel transitions. I'll click. And so this cost-benefit analysis was our first effort to sort of think about a framework that would capture all of these various impacts that cooking transitions can have on households. Click. And then after that, we thought much more about the behavioral aspects of this problem and how to represent them adequately in impact analysis. This is something that we at Duke as economists sort of obsess over. When a household first gets a clean technology, how exactly do they use it? And sort of led us to thinking about how to represent stacking in this tool, for example, so using multiple technologies. Click. Then we actually did some experimentation around demand for technologies, and a lot of the evidence that came out of those initial demand studies is incorporated into the tool. Click. And finally, that sort of led us to think about, a more of a policy analytics tool that could be used to support decision making, and which also allowed us to update this cost-benefit framework that we had developed some time back. Next slide. So let's first take a step back and remember the motivation. Heather has covered much of this, and apologies to those of you for whom this is obvious and unnecessary, but I think it is good to sort of have the overall framing motivation. Next slide. So we know that reliance on traditional stoves and fuels is a global development problem of epic proportions, a silent pandemic that's playing out on a yearly basis, essentially, that contributes to unsafe ambient air, kills millions of people in and outside their homes, and imposes on energy poor people many other types of burdens. Next slide. And though it is truly a global problem, as shown on this map, which shows areas where access to clean cooking technology is particularly low in darker blues, the costs and number of people who are affected are especially high in Africa and South and Southeast Asia. And then there are also burdens that remain important in other parts of Asia as well as in Latin America. Next slide. Moreover, though progress has been made and the number of affected people in Asia is now declining, the situation in Africa is becoming worse due to population growth outpacing dissemination and adoption of clean fuels and technologies. Globally, this means that the number of people without access has remained stuck at around 3 billion, the number that Heather put up in her slides. And despite widespread awareness of the problem, its inclusion in SDG 7 targets and continuing efforts of governments, donors, international organizations, NGOs, and the private sector, we still have a significant problem. Next slide. And of course, there's also broad recognition of the myriad harms of lack of access to clean and modern solutions, which range from highly local household impacts on health, gender equity, and productivity, and household environmental quality, to regional and global impacts on the environment. A continuing challenge in the sector has been the issue of bringing stakeholders who represent some of these various perspectives together in a way that they can see the whole picture rather than focusing on a single element in these negative impacts. From the start of the development of Bar Hap and its precursors, we have endeavored to try to quantify and monetize these effects in a way that allows users to engage with the entire complex picture. Next slide. The other crucial thing to highlight is that there is a massive disconnect between knowing there is a problem and knowing that what should be done about it. This is perhaps the most innovative aspect of the tool. We believe that it facilitates engagement with two particularly difficult features of this problem. First, the question of what technological solutions should be pursued in which countries, given sector-specific or holistic economic objectives of stakeholders. And second, what policies are best suited to facilitate those transitions. Bar Hap can help exploration of both of those questions. Next slide. Thus, we worked with our WHO colleagues to develop an Excel-based tool, Excel-based so that it could be used by a wide set of people that would allow this exploration. Specifically, the tool quantifies the impacts of different technology transitions supported by various policies, given a set of parameter inputs that can be modified by users based on the best available evidence for their setting. In the first phase, we piloted the framework in the case of Nepal, and we held a consultation with a diverse set of stakeholders there to gather feedback. Now in phase 2, we incorporated much of that feedback, built out the global database that supports the country-specific default assumptions, and created a more user-friendly tool. And that's what we're launching today. Next slide. I highlighted the two elements of technology transitions and policy options. Here on this slide, you can see the set of transitions allowed in the tool, which generally go from polluting fuels and stoves to transitional or clean options, as defined by the WHO air quality guidelines, as well as one clean to clean transition that is receiving increasing attention in some settings. That's the move from LPG to electricity. On the policy side, there are 5 main options: stove or fuel subsidies, stove financing, or spreading out of payments over time, intensive behavior change campaigns, and technology bans. The 3 middle policy options can also be combined with stove subsidies by specifying a non-zero stove subsidy in the tool when selecting those 3 policies. And different policies can also be applied to different transitions. Next slide. The user selects which transitions are targeted and which policies support each of those transitions. The model is then essentially an accounting system that keeps track of uptake of solutions as facilitated by those policies and their resulting impacts, subject, of course, to assumptions about the parameters that underlie the relationships between use of improved technology and those consequences. At the end, it provides a set of summary outcomes. Next slide. Grosso modo, we have total social net benefits comprised of costs and benefits. Costs are further tracked at the user, which we call private level, as well as the government level. This disaggregation is important because user costs can be a major barrier to adoption, while government costs can create public budget pressures. Benefits are similarly tracked as user or private benefits and spillovers to others in society who benefit from the adoption of the users themselves. User benefits are again critical to track because these represent enabling features of the transition. Next slide. To be a bit more specific, this slide shows the types of costs and benefits in Bar Hap that fall under each of these perspectives. We keep track of expenditures on stoves and fuels, as well as the costs of government subsidies that reduce those costs for users, plus operation and maintenance, learning, administrative, and promotion costs. On the benefit side, it is reduced mortality and morbidity, the health benefits, time savings, as well as environmental benefits, forest preservation and climate change mitigation. Next slide. Besides looking at the overall summary outcomes, Bar Hap allows exploration of disaggregated impacts across these various categories of costs and benefits, across transitions, and facilitates comparisons of policy implications in terms of the potential benefits they can generate. For those primarily focused on health, there's also the possibility of looking at health cost effectiveness measures expressed in dollars per disability adjusted life year avoided. Next slide. And with that, we'll now have the demonstration of the tool. So over to you, Jessica.
Thanks, Mark. All right. So I'll be providing an overview of the Bar Hap tool, the contents of the various worksheets, and how to navigate them. To download the tool, go to the WHO's CHEST website. We'll be putting this link for you to see in the Q&A box, and click on Module 2, which will take you to this page from which you can click to access the Bar Hap tool. And on the Bar Hap page, which is just syncing now because we've just uploaded the new version of the tool, you are able to download the tool itself, as well as a manual and terms of use for the tool, and a recent publication about this resource, as well as other related tools and resources. We also have a short form available on this page where you can enter your email address if you would like to be notified when we post future software updates to the tool. So now let's go back to the tool itself. This is the new global version of Bar Hap. The tool consists of 23 active worksheets. These are the tabs colored in various shades of green. The workbook also contains a number of additional sheets that have tabs with other colors and are available farther to the right. Users do not need to access these other sheets, but it is possible for advanced users to access additional information stored in these sheets using a password provided in the manual, which is downloadable from the page we were just looking at. In this demonstration, I will focus on the 23 green active worksheets only. The first two tabs are introductory worksheets that provide general information on the tool, the details of which were in Mark's presentation. The Intro User Guide tab gives a review of the 16 transitions to cleaner cooking, as well as the policy options on the right that can be selected within the tool. The third tab has details of data sources that can be used that were used for various parameters. You can click on these tabs at the bottom to navigate through these introductory worksheets. Now let's move to the setup country worksheet. The top of each sheet explains the purpose of the sheet and the steps a user should follow. First, select a country from this drop-down list. The total population and other demographic information in part 1.1 will update automatically based on the country selected. Let's click on View Baseline Burden Summary. This shows a snapshot of the current health, environmental, and time burdens from baseline cooking use, cooking fuel use. Here we see the health section, the morbidity and mortality burden for the 5 diseases for which WHO currently calculates attributable health risk from household air pollution exposure, which are reported for both direct or impacts of exposure to household air pollution from polluting fuels and technologies, as well as the indirect impacts. Indirect impacts account for the exposure to ambient air pollution that is created by household air pollution because household emissions escape to the outdoors. We can click on the Go Back button to return to the setup worksheet. Users can also set the time frame for this scenario between 1 and 31 years and determine whether there is a startup phase, 3, 4, or 5 years, during which the use of cleaner options is gradually increased. Part 1.2 shows the baseline fuels that are currently used in the selected country, based on surveys in which people reported their primary cooking fuel. Here, we can also click to see details on the baseline fuels currently used in the selected country. This is specific fuel use data developed by WHO, which we are pleased to announce is also just launched today and is downloadable from a link that will be shared in the Q&A or chat feature. So again, you can see the use of these specific fuels over time for this selected country. We can click the Go Back button to return. Some parameters are country specific, such as population, household size, number of children, prevalence, incidence of diseases, mortality rates. These will update automatically based on populate automatically based on the selected country. Where country-specific data are unavailable, the tool uses regional estimates or global estimates where regional data are unavailable. The Data Sources tab that we just saw to the left and the manual contain all of the details about what sources were used. For this demonstration today, I will show the results for 2 countries, Cameroon and Bangladesh. Let's start with Cameroon. We select Cameroon here. In part 1.1, we must then select baseline fuels in part 1.3 that the target population currently uses. So we can refer to part 1.2 to see what fuels are currently in use, and then make the selection in part 1.3 of the fuels that we want the population to transition away from. For our example, we will select traditional biomass, traditional charcoal, and kerosene. To go to the next step, click Advance to Transitions, and the next tab, Set Up Transition, opens automatically. Here, all of the transitions from the baseline fuels we selected, traditional biomass, traditional charcoal, and kerosene, are unlocked. The others, which in this case is from LPG to electric, remain grayed out. Now we must decide which types of transitions to promote. That is, which type of cleaner stoves the target population will transition to, and which policy option will be used to achieve each transition. For our example in Cameroon, let's say the traditional stove users will be encouraged to use natural draft improved cook stoves with financing options that make these stoves more affordable. So we will select financing in transition 2. Other traditional stove users will be encouraged to transition to LPG with a fuel subsidy. So we will select fuel subsidy in transition 6. Users of traditional charcoal stoves will be encouraged to shift to more efficient charcoal stoves using stove financing, which allows them to spread payments for the technology over time, which we will indicate in transition 9, and a fuel subsidy to encourage LPG use, which we will indicate in transition 10. Lastly, kerosene stove users will be given a behavior change campaign to encourage shifting to LPG stoves, which we will select in transition 13. Now we must click on Advance to Multi-Transitions here to go to the next step. It is important to click on this button and not to navigate using the tab at the bottom in order for the calculations to work correctly. On clicking Advance to Transitions, we are taken to the next tab, Set Up Multi-Transition. This sheet is used to determine what percentage of the population will shift to each cleaner option. In some cases, you may want to specify that less than 100% of the population shifts to cleaner options, such as when you expect that only part of the population will be targeted. In our example, where baseline fuel users are transitioning to multiple cleaner options, we must specify what percentage of people will shift to each cleaner option. We can see we get an error here because we need to adjust these percentages. Let's assume that 60% of the traditional biomass users will be targeted to transition to natural draft improved cook stoves and 40% to LPG, which we will type in here. And we can see the error is removed. We will also specify that 60% of traditional charcoal users will be targeted for a transition to charcoal improved stove and 40% to LPG. And 100% of kerosene users will be targeted to transition to LPG. So all of the errors have disappeared. And if you would like to use the remaining default assumptions in the tool, which we will do for this example, we can then click on Advanced Results to open the Results Worksheet. Get ready. Again, we have to click on that button rather than navigating through the tabs at the bottom. So here we see our results. We find that there are positive social net benefits at the top, which indicates that the total value of the benefits after removing costs range from $51 million to $89 million, depending on whether or not the social discount rate is included. To see what proportion of the population is covered under these transitions compared to the business as usual scenario, we can go here to click on the SDG 7 progress figure. Here we see the number of people using clean fuels and technologies at baseline on the left in blue, and the total new anticipated users of clean fuels under our scenario on the right, including both clean in blue and transitional options in red. We can thus see progress towards achieving SDG 7 for household energy access. We can click Go Back to return to the main results page. To see the breakdown of total costs and benefits, we click on the categorical cost benefit breakdown. Here we see that the largest benefits are from the decrease in fuel costs at the top, 260 million, followed by climate change mitigation, 160 million, and mortality reduction, around 150 million. We can click to go back. To see how much of the net present value is from each transition, we can click on the cost benefit analysis by transition button. Net present value is the value in today's dollars that we expect to have gained or lost after the program duration. We see that the transitions to LPG from traditional unprocessed biomass and charcoal, so these two at the bottom, both generate negative net present value. However, the transition to natural draft improved cook stove from traditional biomass under stove financing generates the highest total net present value. And then we click to go back. Let's review the costs. The yearly governmental costs from the scenario we ran are around, here we are, the total government costs are yearly are 38 million US dollars, which include administrative, stove subsidy, fuel subsidy, and program costs. While the yearly private costs to the household, to the users, are around 4 million US dollars, which includes stove costs after subsidy, maintenance costs, and learning costs. The total benefits we see per year are around $29 million. We see a large number of avoided COPD cases, and we also can view here a cost effectiveness estimate from the proposed scenario. On average, an adopting household in Cameroon, see there's time savings here, saves around 521 hours per year, and the scenario has a reduction of climate forcing pollutants valued at around $11 million per year, and an unsustainable wood harvest avoided valued at around $92,000 per year. If you would like to see how the selected policy intervention compares to other possible interventions for each transition, you can click on each of the benefit breakdowns, such as this one, and this one, to see the comparative graphs. To show you an example, let's look at the detailed health breakdown. Click here. In our first two selected transitions, so here we see for morbidity and mortality, and I'll just focus on mortality, zoom in a little bit. In our first two selected transitions, which are these two on the left, we see that the health benefits under the polluting technology ban, which is the second bar from the right in each of these examples, so the tallest bars, would have been higher than the health benefits under the stove financing option that we used here, and the fuel subsidy option that we used when we were encouraging a switch to LPG. However, a technology ban is very challenging to implement in practice. And let's also note that this graph provides a comparison of the benefits, but does not account for the costs of each scenario. Now we can click to go back. So that was a first example in which we accepted most of the default information, and I'll start the tool over to run a different scenario with another country. To do so, we must reset the entire tool, which we can do by clicking here. And we'll have a pop-up to ensure that that's actually what you'd like to do, which in our case we do. For our second example, we will use Bangladesh. And it can take around 40 seconds to reset the entire tool as all of the macros are resetting. So here we come back to part 1.1 and we select Bangladesh. And again, we can refer to what the existing baseline fuels are and make the selection of what we'd like to transition the population away from. In this case, we will look at transitioning away from traditional biomass. On clicking Advanced to Transitions, we are taken to the Setup Transition tab. Here, all of the transitions from the selected baseline fuels, which were just traditional biomass, are unlocked, so the rest of them are grayed out this time. Let's say that some traditional biomass users will be targeted to transition to an improved natural draft stove with financing, which is under Transition 2. And some to an improved forced draft stove through financing as well in Transition 3. And some to LPG through a fuel subsidy in Transition 6. On clicking Advanced to Transitions, we are taken to the next tab, Setup Multitransitions. We see there's an error reminding us to fix the percentage of the populations here. Since traditional biomass users are being targeted to transition to 3 different types of cleaner options, we need to specify how much of the population will be targeted for each. Let's say that 40% of the population of traditional biomass users will be targeted to transition to natural draft improved stoves, 20% to forced draft improved stoves, and 40% to LPG. So now we see the error is removed. To use the default assumptions, we'll click on Advanced Results, and it will take us to the Results Bar Summary Worksheet. We see from this scenario, the top, there are in fact negative social net benefits, and the parentheses here indicate a negative value. On the costs, we see that the yearly governmental costs are around $500 million here, which includes administrative, stove subsidy, fuel subsidy, and program costs, while the yearly private costs to stove users are around $36 million, which includes stove costs after subsidy, fuel subsidy, and program, which includes stove costs after subsidy, maintenance costs, and learning costs. The total benefits per year, scrolling down, are around $500 million, which are mostly from health and climate benefits. And we can see the separation of what the value is for health benefits here, as well as for climate benefits down here. So to summarize, using the default data for this example, the scenario does have very large benefits, $500 or so million a year. However, they are outweighed by the high estimated costs. So the default usage rate for improved or clean cook stoves included in the tool is 48%, which reflects the expected stove stacking. Let's increase it and see how these results change. Let's go to the Setup Multitransition tab by clicking here at the top to navigate to Essential Parameters and then to Multitransition. From here, we can click on Advanced to Custom Parameters. So this is what we had set before, but instead of just advancing to results, we'll change some of the custom parameters. This takes us to the Setup Basic Custom tab. And from here, we can click on Confirm Changes. We won't make any changes to this sheet, although, of course, users are welcome to do so. And so we click on Confirm Changes, and then we can click on Go to Advanced Parameters, which will take us to the next tab, Setup Advanced. In Setup Advanced, there is a variable here called Use Rate of ICS, Improved Cook Stoves. This variable indicates that for households getting a cleaner stove, they will only use it 48% of the time to reflect expected stove stacking. Let's try changing this use rate instead to 80%. And then we can click to confirm. And this will take us sequentially through each of these advanced sheets where we have the opportunity to adjust any of the default data. For this demonstration, we'll just click to confirm to move through these other sheets, but you can get a glimpse of the opportunity to adjust default data, including here in the Setup Advanced Health sheet, the tool currently uses WHO mortality data as default, but if users are interested in using global burden of disease mortality data, they can click this button to change that. We'll click to confirm. And then finally, we'll be returned to the results page. After making this one change in that variable, we see that we now have estimated positive social net benefits around 8.3 billion US dollars. In other words, because we increased the amount of time that users are using their improved stoves and cleaner cooking options, the benefits increased substantially and are now greater than the costs. If we click Cost Benefit Analysis, the CBA by Transition button up here, we can now see that all transitions have a positive net present value. We can go back, and in the categorical cost benefit breakdown, we see that the greatest benefits are from mortality reductions here, as well as climate change mitigation. So that was a quick walkthrough of 2 examples from the tool, which we hope was helpful. And we really welcome your feedback on using the tool. If you have any questions or comments about how we can improve the tool. I'll stop sharing now and turn back to Mark.
Thanks very much, Jess, for that great demonstration. So I'm now going to spend a bit more time discussing some of the key considerations that users should keep in mind when they're using Bar Hap. Next slide. So there's a large set of assumptions, as you saw in that demo, and these are modifiable in the tool. These assumptions are what drive model results. Users should consult the manual available with the tool for details on what all of the parameters mean, what the data sources are for them. And they should familiarize themselves generally as much as possible with the tool relationships and parameter assumptions. For basic users who are not likely to make structural changes to the tool, we have locked the model to reduce the likelihood of user modification that could compromise its functioning. But the tool can be unlocked by anyone, and the password is in the user manual. Advanced users may want to improve on some aspects of the tool. They may question some of the assumptions that we've made, and we encourage such improvements and experimentation from those who would like to try. We also hope that you'll communicate with us when you see something that you think should be modified. Today, I'll highlight a few additional key considerations around model assumptions. Next slide. As we have noted, Bar Hap links policy interventions to impacts. Critical in that is a set of assumptions about the effectiveness of those interventions. For example, when policies change user costs by decreasing prices or by allowing financing, what will happen to demand and adoption of better technology? We have built demand curves into the model, but there's relatively limited evidence on demand on which we could draw. Demand curves for different types of solutions should always be revisited based on the best available evidence in a particular place. Otherwise, adoption will not be appropriately specified. And just to speak to one question that's in the chat about perhaps the main problem with LPG adoption being an issue of availability of cylinders, this could be reflected in those sort of demand curves. If you were to reduce the price to 0 and you still couldn't reach some of the households, you would want your demand curve to reflect that based on where LPG is available. Next, click. There's also a similar issue for fuels that relates to fuel costs. Here again, we have specified price sensitivity based on what evidence we were able to find, which is again fairly limited. Click. Once a household adopts a new technology, it is likely to still stack that technology alongside other old options that it had, at least for some time. In Bar Hap, the stacking intensity is one parameter that does not vary automatically with the subsidy level. So Jess talked about this use rate and the importance of that parameter. In reality, there might be a relationship between that parameter and the price of fuel. So users should again incorporate the best available evidence they have on use rates, or explore sensitivity to that assumption in particular when conducting their policy analysis. Click. Besides stacking, another important parameter for health relates to cooking behavior responses that concern time spent in the kitchen or in close proximity to a pollution source. We include something called an exposure adjustment parameter for improved and traditional technology that implies that people spend less time in proximity of a highly polluting source compared to a less polluting one. And this is based on evidence from a recent meta-analysis. Next. On the cost side, the promotion cost parameter is an important one that relates to how new solutions are made available to target beneficiaries beyond simple manufacturing costs. Again, this could represent some of those supply chain aspects if supply chains were being built out. So this is the supply side of that question. It stands to reason that these costs will be higher in remote, hard to reach areas relative to urban centers. Next. Of course, there are many other assumptions undergirding the Bar Hap accounting system, and users should engage with the data as far as they can to improve the relevance and accuracy of their analyses. Next. Also, the model is largely static in the sense that we do not build in the ongoing fuel transition and population dynamics of a country. We're hoping to work on this aspect of the tool in the future, and the data to do so are largely in place. But it will take some more work for us to get that functionality going. Next slide. Okay, so now for a few closing thoughts on the tool and user engagement. Next slide. To reiterate, with Bar Hap, policymakers can explore questions related to which technologies to support with which policies, given the situation in their country. They can do so by comparing monetized costs and benefits, as well as non-monetized outcomes. And they can consider user and public financing perspectives. They can examine trade-offs, for example, between policies that achieve higher health benefits and those that may generate other types of benefits, or that cost less. Finally, and perhaps most importantly, they can engage in a cross-sectoral conversation about priorities and goals and how best to achieve them. Next slide. At the end of the day, we hope that Bar Hap will help users see connections better across these diverse objectives and understand advantages and disadvantages of different policy interventions in a way that no prior tool or model allows. Of course, it is still a model and subject to the assumptions within it, so users should consider them carefully. Next slide. With that, some final advice and a request. We have worked hard to make the tool user-friendly in this version, such that users can use it without adding new data, but still allowing them to change these inputs as they see fit. For advanced users, there's an option to make more significant changes. If you do so, please let us know. And also let us know if you think the tool is great or if you think it's terrible. We will appreciate hearing from you no matter what, and we'll work to try to make further improvements based on the feedback that you provide. Next slide. Thanks so much for your attention and to all who contributed to the tool development to date. And that closes my presentation.
Great, thank you so much, Mark and Jess, for the overview of the tool. I know we've had some questions come in, some of which Mark has kindly answered in the Q&A function. And I think that just in the interest of time, since we're a little bit behind, we'll continue on to the next presentation and then take questions about the tool and the presentation at the end. So with that, I'd like to pass things over to Ipsita Das, who will take us through an example of how the framework that underpins the tool has been used in practice, specifically on an investment case for clean cooking in Nepal. So Ipsita, over to you.
Thanks very much, Julie. Hello, everyone. The cost, benefit, and policy analysis of clean cooking transitions in Kathmandu Valley that I'll be presenting today is joint work with Mark Juland. Next slide. To give some background on this study, much of the energy transitions in low and middle income countries have been studied in rural settings. But urban areas in LMICs also have significant disparities in clean cooking access, especially among low-income populations. And rising ambient air pollution levels in most major cities in these countries require multiple mitigation strategies to address both household and ambient air pollution. While our analysis was conducted in Nairobi and Kathmandu Valley as illustrative urban cases in sub-Saharan Africa and South Asia, in today's presentation, I will focus on the Nepal investment case. In Nepal, there are national plans on cleaner fuel promotion and efficient improved cook stoves, as well as a big policy push for electric cooking using the country's abundant hydropower resources and move away from LPG, given Nepal's experience with the trade blockade in 2015. Next slide. In urban Nepal, while LPG forms the highest share of primary cooking fuels, firewood forms nearly 30% of the primary cooking fuel mix. This figure serves as a reminder that specific initiatives remain necessary to complete the energy transition in urban centers of Nepal. Next slide. Our study is timely given the dynamic policy environment in Nepal with respect to clean cooking. From a research perspective, two reasons why this study is important. First, while cost-benefit analyses of clean cooking have been done at the regional and household levels, none has been done at the city level. Most cost-benefit analysis studies of stove technologies are either conducted in peri-urban or rural areas. There remains a blind spot in the global community's understanding of clean cooking energy use in urban centers of developing countries. Second, none of the previous studies has considered how specific policy interventions, such as subsidies or other incentives, might shift the private net benefits of household cooking transitions. Next slide. The objectives of our study were twofold. First, the development of city-level assessment that included the baseline situation regarding health, environment, and social impacts, and the benefits achievable from fully transitioning to locally relevant technologies. The second objective was to develop investment cases for applicable improved and clean cooking scenarios with 5 policy instruments. In the interest of time, today I will show you results from the second objective only. Next slide. Using frameworks that were previously developed, details of which were in Mark's presentation of the Bar Hap Tool, we developed a framework for analysis of urban clean cooking transitions. We incorporated accounting for the contribution of domestic fuel burning to ambient PM2.5 concentrations and exposures. We also aggregated costs and benefits at the city level and characterized the costs and benefits of specific policies based on the likely behavioral responses they would stimulate. Next slide. Our data collection was twofold. First, in the policy engagement piece, we interviewed various stakeholders in the clean cooking sector to learn about previous, existing, and planned policies around clean cooking. These included central government agencies, improved cook stove companies, local and international NGOs, and donor agencies. We also collected relevant data from these stakeholders. Next slide. Second, we conducted a cross-sectional primary survey in Kathmandu Valley in July to August 2019. Our study areas were peri-urban wards in the districts of Kathmandu, Lalitpur, and Bhaktapur. In our 360 study households, in addition to asking about socio-demographics, stove and fuel use, we also conducted a contingent valuation experiment to assess households' willingness to pay for cooking fuels, primarily LPG and firewood. Next slide. Our interviews with stakeholders in Kathmandu Valley gave us 5 cooking transitions to consider. The first is from traditional firewood stove users to natural draft improved cook stoves, which is an important transition to consider for low-income peri-urban populations with free access to firewood. The second transition is from traditional firewood users to LPG, given that it's currently the most widely available fuel in the country. The third is from traditional firewood users to electric cook stoves, which is aligned with the government's policy. Fourth is from LPG to electric cooking, as during the 2015 trade blockade, some urban households in Nepal, especially in Kathmandu, coped with LPG shortages by turning to electric cooking. Finally, a transition from electric cooking to LPG if the cost of electricity is high or there is misalignment with cooking preferences, among other reasons. In our analysis, we incorporate 5 commonly used policy instruments for spurring clean cooking, identical to those in the Bar Hap Tool. The polluting fuel ban, however, does not apply in the transition from LPG to electricity and vice versa. Next slide. The costs and benefits included in our analysis are similar to what are included in the Bar Hap tool, so I won't go over them in detail here. Next slide. Our analysis included 30 parameters, more than 30 parameters, which vary by type of stove. Owing to the large range of the parameters, there is some uncertainty in our calculations. Next slide. The cost-benefit model used secondary data to supplement our non-random sample of surveys targeted specifically at households in areas that use a mix of traditional and clean cooking fuels. We were able to get context-specific data for parameters such as stove and fuel costs, lifespan of stoves, and household size. But for many others, we used global data such as stove efficiencies, uptake rates, and valuation parameters. Next slide. We use 4 economic metrics for comparing cooking transitions. First, private net benefits should be positive to foster adoption of the cooking solutions. Second, social net benefits should be positive and high to generate social value. Third, the transitions should impose a modest cost burden on the government. And finally, the transitions should generate pro-poor outcomes. In addition to these 4 metrics, we also consider logistical aspects of the cooking transitions. Next slide. Here are the first set of results. We find that fuel subsidies for LPG and electricity are clearly attractive from a private standpoint. Of the 5 cooking transitions, the transition from LPG to electric stoves generates positive private net benefits under all policy interventions, the highest being for the combined stove and fuel subsidy option, followed by the stove financing and stove subsidy option. In transitions 1, 2, and 3, the private net benefits of firewood ban are negative, owing to the high net cost to those who would not have transitioned in the absence of a ban. Next slide. From the social net benefits perspective, for the firewood to electricity transition, the highest monthly social net benefits are realized with a ban on firewood, while for the LPG to electricity transition, these benefits are greatest with a stove subsidy plus stove financing policy. But the high enforcement costs of a ban and the reality of stove stacking could make a firewood ban challenging. For the firewood to electricity transition, an alternative that delivers nearly the same social net benefits as the ban is the combined stove and fuel subsidy option. But this policy would also face important practical challenges, since it might be difficult to target electricity subsidies to cooking activities alone. The third most cost beneficial policy option then is the stove subsidy with stove financing. Behavior change communication campaigns are also attractive in this transition. For more efficient wood burning improved cook stoves in transition 1, financing and stove subsidies could be beneficial. However, transitioning existing firewood users to LPG, that is transition 2, appears to have limited effects. Next slide. Fuel subsidies for LPG and electricity have the highest private net benefits, but these have public costs that are an order of magnitude higher than the other interventions. The next most expensive policy option is the firewood ban for transitions 1, 2, and 3. And the third most expensive policy intervention is the stove subsidy with stove financing. Next slide. Here is a summary of the most economically viable policy interventions in Kathmandu Valley. We see that of all cooking transitions, owing to the number of households using LPG in Kathmandu Valley, transitions from LPG to electric cooking are potentially most favorable under the stove financing plus stove subsidy option. Transitions away from traditional firewood stoves to electric stoves are also attractive and likely to be pro-poor, though they affect a smaller fraction of households. While stove subsidy and fuel subsidy has high private and social net benefits, targeting of households is difficult in practice, as subsidies end up mostly benefiting higher income households. It is also not possible to subsidize electricity only for cooking without improvements in technology. With a stove subsidy and stove financing policy, this transition from traditional firewood stoves to electric stoves would have positive monthly social net benefits. Next slide. To summarize the results, transitions from firewood and LPG to electricity appear most attractive, facilitated using a combined stove subsidy and financing intervention. However, there is low usage of electricity as a primary cooking fuel currently in Kathmandu Valley. While middle to high income households use a mix of LPG and electricity, there is need for the government to encourage low income households to adopt electric cooking. Most importantly, To facilitate large-scale electric cooking adoption, it is imperative that the government strengthen grid distribution lines, generate surplus electricity in hydropower projects, and consider supporting development of the supply chain for induction cooking technology. I'll stop there. Thanks a lot for listening, and we are happy to answer any questions you have. Over to you, Julie.
Great, thank you so much, Ipsita. Super interesting results, and I'm sure a lot to take in for folks. So as Ipsita said, her and Mark and Jess and others will remain on for questions at the end of the webinar. It looks like we're going to be really tight on time for the Q&A session. So again, we'll have our speakers stay on for another 15 minutes or so after the end of the webinar to answer any remaining questions that folks may have. And I think Mark has also shared his email address if people want to follow up directly. So with that, let's move on to another example, this time for Kenya, of how this analysis has been used. And this was used specifically to look at the impacts of the reimposition of a value-added tax. So I will hand things over to Mark from the Duke team to take us through this example.
Thank you, Julie. So I'm happy to present this analysis. This is a very practical policy case that we worked on fairly recently with a number of different partners, and so it's nice to present it. I'll also note that this was done not using Bar Hap itself, because Bar Hap doesn't have this option in it, which is actually adding a tax on cleaner cooking solutions. Instead, we consider subsidies, but the framework is essentially the same. It's just sort of reversed in thinking about what happens when households now move away from cleaner cooking technologies, especially as they're replacing their stoves over time. Okay, so the team that did this, as I mentioned, included researchers from the Duke team as well as EED Advisory, who led a lot of data collection and analytical efforts. The Clean Cooking Alliance, who helped support the study and kept us on track, and then the Clean Cooking Association of Kenya, which was really focused on the policy engagement in Kenya. Next slide. So I'll begin with an overview. We'll start with study objectives, followed by context of the cooking sector in Kenya and the situation of the value-added tax. These provide background for the main analysis, where we examine implications of the VAT for clean cooking objectives and related social outcomes. And then we'll end with evidence-based recommendations that we made and reflect on the role of the analysis. Because we have fairly limited time to talk about methods, I'll mostly focus on the context and results in this presentation. Next slide. So considering the study objectives first, next slide. There were two main objectives. First, to engage with a broad range of stakeholders to understand the VAT policy context and to understand expectations of impacts of removing VAT exemptions for the clean cooking sector. So we talked to stove producers, LPG suppliers, as well as households, donors and policymakers, government officials in different ministries. Second, then we carried out an analysis using the cost-benefit framework to understand the implications of the VAT policy for government revenue, as well as for Kenyan society and households using cooking energy of different types. Next slide. So we'll turn to background and context now, starting with the clean cooking context. Next slide. So here the government of Kenya has embraced the call to action for Sustainable Development Goal 7, which has, among other targets, a goal of universal access to clean cooking solutions by 2030. The Kenyan government actually announced in 2019 that it hoped to reach this goal by 2028 through a mix of use of clean fuels like LPG, ethanol, biogas, and electricity, as well as high-efficiency solid fuel stoves that use wood and charcoal. Recognizing that there are a number of challenges in achieving this objective, the government has worked with donors to implement a number of programs and to encourage private sector initiative to disseminate solutions to more people. Next slide. And yet, if you observe the progress over the last 20 years, we see major challenges in reaching this objective. So these are simple trend lines extrapolated from the historical fuel use changes between 2000 and 2020 into the future. So we kind of use this to think about what a business as usual policy case looks like. And while use of clean fuels, mostly LPG, has been rising over time, especially in urban areas, trends have largely been flat in rural areas and overall. Firewood use remains high, with more than 60% of households nationally relying on it as their primary source of cooking fuel. If improved efficiency stoves were penetrating quickly, this could still allow meeting the targets with transitional technology. But today, only about 15% of solid fuel users use such improved stoves. Thus, based on current fuel use trajectories and given urbanization and population growth trends, we estimate that just under 50% of Kenyan households will still use traditional solid fuel cooking technology even in 2030, with use of clean fuels and improved solid fuels well off the levels needed to achieve SDG 7. And this is the no VAT trajectory because many of these solutions have been historically exempt to the VAT. Next slide. But the VAT situation is actually complicated. Next slide. So this slide kind of tells a bit of that complicated picture, which is that import duties and the VAT, the value added tax, have varied considerably over time. They've been applied in inconsistent ways across different types of solutions. And the rates have varied over time as well. So the government has tried to provide exemptions that would support development of the sector. And improved cook stoves and LPG were exempt prior to the 2020 Finance Act. Yet some clean fuels like ethanol were traditionally not used for cooking and faced the full VAT, having a relative disadvantage compared to LPG. Import duties for raw materials and imported stoves have long affected stove producers as well. Overall, the unpredictability of tax policy has created considerable investment uncertainty for the private sector that's trying to promote solutions. Next slide. It is important to recognize, though, that the VAT plays an important role in the revenue that's raised by the government of Kenya. It contributes about 22% of the government's revenue and about 400 billion Kenyan shillings annually. There's increased need to raise more revenue to fund social and development programs, and VAT exemptions have been singled out as particularly costly in creating revenue losses, particularly by the IMF. Next slide. So then we move to our analysis. Next slide. Our analysis was set up to consider how households using different types of cook stoves and fuels are affected by the VAT policy once these are taxed. So we again use the same kinds of demand principles that exist in the Bar Hap tool, except that now we're talking about a cost increase. As such, we consider relative to the pre-VAT trajectory that I just showed you, how many fewer households would transition to continue using LPG, kerosene, and improved charcoal and firewood stoves, and instead opt for more polluting technology, right? We analyzed two scenarios, one that had the VAT imposed on both stoves and LPG fuel. And that's the one that we call scenario 1. And then the second represents the VAT that is only imposed on improved cooking technology. That's similar to the one that was implemented over the past year, while LPG remained exempt. Next slide. So here, this slide shows the estimated increase in households using traditional solid fuels and fuel stoves in red for scenarios 1 and 2. And then the decline in households using LPG fuel and improved cook stoves, respectively, in green and blue. And this is because the VAT on LPG fuel leads to some of these households reverting to biomass ICS, and some of them reverting to solid fuel ICS. And then some of the households who would otherwise use ICS now are going back to traditional technologies. When LPG is taxed, about 90,000 fewer households are primary users of that fuel by 2030. And so progress in meeting SDG 7 is likely to be further eroded by this policy. Next slide. Then we consider some broader impacts. These will be familiar based on what you saw for Bar Hap. Next slide. And in terms of revenue, the VAT levied on both ICS and LPG generates about 4 times the revenue of the simple ICS levy. But this revenue in scenario 1, so where it's higher, is still only about 0.05% of annual GDP and will not really significantly affect the government's debt situation. Scenario 2 is even more modest, about 0.01% of annual GDP additional revenue. Next slide. And if we look at the overall net benefits in both scenarios, the net effects for Kenya are overall sharply negative, especially in the first scenario that also generates more revenue. These negative impacts come from health and climate damages, and in scenario 1, from higher fuel expenditures for households who have to pay more for LPG. All in all, both policies are highly inefficient, reflecting the common adage among economists that one should avoid taxing goods that deliver positive social spillovers or externalities. Next slide. And so with that, on to our recommendations. Next slide, which is my final one. We made 5 recommendations. We suggested that the government should reinstate VAT exemptions that were rolled back in 2020 with the Finance Act. Second, we thought they should extend and continue the exemption for LPG to also cover stoves. Third, to reduce investment uncertainty by committing to 5-year exemptions for cleaner cooking solutions, so having a stable policy environment. Fourth, noting that some additional revenue from the sector may be needed. If anything, it should come from increasing taxes on kerosene, which is a highly polluting and health damaging fuel. And then finally, to enhance efforts generally to accelerate SDG 7 progress by finding ways to increase affordability rather than making these clean solutions more expensive for households. And unfortunately, for this year, few of these recommendations were taken up. Just to highlight the continuing policy uncertainty in Kenya, the fuels and stoves that were subject to the exemption this year are biogas, ethanol for the first time, and some processed biomass fuels, whereas LPG and efficient stoves are going to be subject to the VAT in 2021. But we're not giving up. I think we'll continue to talk about this analysis and work with stakeholders. And thanks a lot for your attention to this work.
Great, thank you so much, Mark. And I'll also just say from CCA's perspective, we had hoped to see more of these recommendations taken up. I think the analysis was really important in getting some of the exemptions that Mark mentioned passed. But as Mark said, we were not successful in making the case for an exemption for LPG. We were, of course, not the only ones pushing for that. The LPG industry was also doing their own efforts to push for that. I think really disappointing was the fact that the exemption was not approved for efficient stoves. That seems to be in some part just due to some unfortunate confusion about wording in the way the bill was developed. So yeah, it's a very, as we all know, the clean cooking sort of issue in general in the sector is very complex. And since we do have a number of sort of solutions and ways to solve for it, that's a great thing, and that there's flexibility, but it can also lead to confusion as well for some folks. So yeah, as Mark said, it was sort of a partial win, but we're not giving up just yet. So we'll continue to push for these types of exemptions in Kenya, but also beyond, because as Mark says, it's often really inefficient for governments to tax goods that have social benefits. So more to come there. We are at time. We had a lot of great content to get through today. Super exciting again, and congrats to the team for launching the Bar Hap Tool. Also glad that we could share some of the country-specific examples with you all. So many thanks to our speakers and to our participants for joining us today. As I mentioned earlier, our speakers have graciously agreed to stay on for an additional 15 minutes or so in case there are additional questions coming in. We can take some of those live right now if people want to stay on for a few minutes. I know there were some that the speakers thought would be great to get to. So maybe a sort of general one about the Bar Hap tool. Just a general question of what is Bar Hap most useful for? Where can it best be used? And perhaps Mark, you want to take that one, or Jess?
Sure. Can you repeat it? Just
Yeah, sure.
Yep.
Just a sort of general question of what is Bar Hap most useful for?
Mm-hmm.
What are some examples? Sorry, I'm reading the changes to questions that it could be used for.
No problem. I think Jess can also jump in here, but in general, I feel like it could be quite useful for national policymaking to understand, given a country's situation and the starting point in terms of the mix of fuels and technologies that are being used, what transitions might be the ones that are most amenable to policy action that delivers benefits and progress towards meeting the SDG goal. So, it can facilitate that national conversation. And then, which policies help support that best? Because some policies may be entirely ineffective, depending on what the effects of those policies are and, how appropriate they are for the specific context as well. And other policies may be very effective. And so, I think that this kind of national conversation is sort of the first application that we really had in mind. But even beyond that, it can be used more broadly for more limited programs. I think, there were some questions about whether this could be used in the context of specific interventions or projects, promotion projects, and I think it can be. Of course, the question of what data to bring to bear on that, whether the national data are appropriate and representative of that policy case or that project case would have to be answered and asked by those using it. But it doesn't need to be a national analysis. It can also be much more specific or focused on particular regions, particular types of households like rural versus urban, and so forth. Jess, do you want to add anything to that?
No, that's great. Well, okay, I'll just build on your last point about the rural and urban issue, that this is something we are planning to add in a future update, the ability to look at subsets of the population like urban or rural regions.
Great, thank you both. And maybe that's a good segue to another question that we had, which was about what are the plans to add other clean fuels to Bar Hap that are currently not included. Some examples we heard were bio-LPG, solar, and ethanol. So if Mark or Jess could speak a bit more to that question, that'd be great.
So ethanol is there. Jess, do you want to talk about the others?
Go ahead. I'll complement.
Yeah, so ethanol is there. I'm not too familiar with bio-LPG and whether that's different than ethanol, but maybe Jess knows. And then solar is one that we've talked about to some degree. And the challenge with solar and including solar is that we don't have a lot of information from the field on exactly what happens to households who use solar and how it's used. but we continue to sort of think about it as a potential option to include in the future. There's no plan to currently add fuels, but it's something we could discuss moving forward. Jess?
Thanks. Yes, so as Mark said, there is a transition option to move to ethanol now, and the 3 fuels that Julie mentioned are all fuels that WHO does consider to be clean for health at the point of use. So of course, we want to encourage analysis of switching to these options, but at least in the case of solar and bio LPG, these are used in a very small number of people globally also, so there is less data on them. And for the case of bio LPG, there would be different climate impacts than the traditional LPG that we've included, but we haven't felt that they were a priority to build out at this time due to their small percentage of use. Although users could adjust, if you wanted to do an analysis on bio LPG, for example, an advanced user could adjust the default data for LPG to make it reflect the characteristics of bio LPG. And for solar, we continue to keep that on our list of potential future expansions.
And just to add to what Jess just said there at the end, each of these transitional technologies or clean technologies that are in the tool are just labeled that way. And the default parameters go with those labels. But an advanced user, as she mentioned, could, sort of take the LPG line and just put in the bio LPG characteristics instead, including sort of the emissions factors that are associated with that, change them from the standard LPG, and then do their analysis that way. So I think it is possible to do so, and the same thing can happen with other stoves as well. If you want to include some type of stove that's not there, you can change the characteristics of one of the existing stove options accordingly, and you just have to keep in mind that you've changed the definition of that label.
Great. Thank you for that. And again, I think there's probably folks who have a lot of follow-up questions. So would encourage you to reach out to the speakers directly for some of the more specific questions if they've not already been answered. Maybe we'll take one more specifically looking, oh, nope, so that's already been answered. Okay, maybe we'll take one last question again about the tool. And this one is about what are the main drivers of negative versus positive results? What should be adjusted? That is to say, targeted for investment to obtain more positive results.
So there's no single answer here because there are a number of factors that drive the results. But some of the parameters that I highlighted in my presentation around the effectiveness of interventions and the take up of solutions are some of the most critical ones, right? So one thing that happens oftentimes if you do an analysis is that you don't get any uptake of the solutions because the solutions are simply too expensive. And that's reflective of reality. We know that affordability is a major challenge in this sector. But if the prices are too high, you're not going to get adoption of those solutions. But there are still costs associated with the administration and implementation of that program. And so that's going to drive negative results sometimes. So one thing for users to consider carefully is, are my policy instruments strong enough? Are these technologies appropriate for the setting that we're considering given their cost, or do we need to think about lower cost options? Another really, really important parameter is that use parameter. How much do people use these improved solutions once they have them? It's the extent of stacking that persists. And that's, that's a parameter that's hard to change, right? It's amenable to some policy influence based on reducing costs, behavior change campaigns. But we know that this behavior is hard to change. So, our default assumption is pretty realistic on the use parameter. But if, people are convinced that their interventions in a particular country have been effective at getting much higher use rates, they're going to have to adjust that parameter. But this leads to another, sort of important point, which is the objective of using Bar Hap should not be to make the policy look good, right? By changing the parameters until the intervention looks good. Users should really think carefully about how they could actually get there with the solutions that exist. And so, just changing that use parameter so that you generate positive results is not going to be helpful if then you implement those programs and they don't work, right? And so then, people will ask questions about, why you thought these interventions would be so great. So that's just a word of caution that, don't sort of just run the analysis to generate results, but actually use it to help guide decision-making around what is important and how to get there. Jess, do you want to add to that?
No, that was great.
Great. Yeah, no, I think that's a really great word of caution to end on, and nice clarification on sort of what the intended use of the tool is, and how it can sort of be used most effectively. So we are well over time. Again, thank you so much to our speakers today, and to our participants who stayed on after the hour to continue listening. A reminder that these webinars are part of a series, again supported by the Clean Cooking Alliance and the World Health Organization. We are sort of taking a pause for August as many folks go on holiday, and then we'll restart back again in September with our next session that will be focused on clean cooking fuels and technologies. In October, we'll look at standards and building capacity for the adoption and adaptation of those. And then in November, we'll look at clean cooking and climate change in the lead up to COP. Please join us for these additional sessions. And with that, I think we will go ahead and close. Thank you again to all.